everyone. Welcome back to another lecture. We are going to continue our conversation about the skeletal system, and you can see we have a guest today. We're going to be talking about the axial skeleton, so make sure you are following along with that correct PowerPoint. This one, in terms of the slide number, there are quite a few, only because there are a lot of images. So like I mentioned in previous lectures, the good thing about me keeping these short is you can kind of get through them, but also you can go back and pause and re-listen and look at the images more than once, right? So you have that ability. So I'll try to move a little quickly as we go through these now. At this point, you should have received from me in class at some point, probably the first day, a list called the bone list. Now, in terms of this course, this intro level course, I'm not going to make you learn every single bone of the body, right? I'm not going to make you learn every feature of every bone. I have a small subset that I want you to know for this class, and that's everything on that list. So I'm sure when I handed out that piece of paper, I went over it. But just to kind of reiterate, you only have to know what's on that list. So as we're kind of going through today's lecture and I'm pointing out a few things you can use, you can kind of follow along on your list if you want, or check them, or however you want. You will have access to a whole bunch of bones in class in the lab. So if you're thinking, okay, I know she's showing me on the video, but I need to kind of see it on my side, I need to hold it in my hands, you will absolutely have that ability for a couple of the days when we do the skeletal section to be able to look at everything, you know, move it, hold it, touch it, all of that. Okay. So we're starting with the axial skeleton. First slide, once again, kind of reiterating, showing you some of those differences between like axial versus appendicular. You can see in the image with the color differences. We talked about that on the last one. And then the axial, just reiterating that it's the skull, the chest, or like the thorax, and then the vertebral column. So here we've got the skull, like the chest area, and then, you know, the vertebral column. So the next slide, the skull. And you can see here I've got a skull here, so I can kind of zoom in with some of these things and point them out to you. So the skull is made up of both the cranium, which we have here, and then the mandible. So that's the jawbone, right? I don't have that one for this guy, right, or this female right here. But it's both of those things together make up the skull. And recall on the previous lecture we talked about the joint types like fibrous, cartilaginous, synovial. So the only synovial joint that we have in our skull is the connection between the mandible and the temporal bone, which we'll talk about. So this allows you to move your jaw. It's a freely movable joint versus the rest, recall we talked about with all these connections, that's a joint, but those are called fibrous joints. So moving on to the next slide, getting right into the names of the bones. Okay, so the first one is called the frontal bone. And if you can see on the PowerPoint, the image, that bone is highlighted, so you can see very clearly which bone I'm talking about. So on this individual, it's in the front. That's kind of a nice way to remember it, right? The frontal bone. So it's this bone right here, and you can see the lines where it would be like the glare off. Of course, there's a huge glare, where the line markers would show, okay, this bone versus like another bone, right? So the frontal bone, it's the big forehead bone. There are 3 features that I want you to know for this bone. Now, I'm going to go through these. I would say adhere to what's on the bone list itself. As I go through this PowerPoint, there's always the chance that I adjust, maybe I take out a couple. So I would say if maybe there's a disconnect, maybe I mention one more item on here than I do on the bone list. Just go off what's on the actual list, it's fine. And I'm not going to ask you at every single little tiny one of these. So just in a general sense, know the ones I've given you, and you're going to be fine. So 3 features that you'd want to know for this bone. We've got the supraorbital margin. So supraorbital, hopefully that makes you think of the eye orbit and maybe like the top of the eye orbit. So it's literally just the edge. Like if I put my finger right here and felt like the edge of the eye orbit, that's what it is. It's supraorbital margin. Like I'm just literally feeling the edge, the inner part, the inner edge of the orbital bone. Or the orbital section, I'm sorry. The next feature is the superciliary arch. So on this area, it's slightly raised. You'll see it right here, slightly raised. Now, in male humans, it tends to be way more pronounced than in females. Females could either have a tiny bit or basically nothing. But either way, that area, the superciliary arch, that's still the name of that region. Now, I always remembered it as like the arch to your eyebrow, so your superciliary arch. It's in the area like right above your eye, right? And then the next one is glabella. Glabella is, you're kind of eyeballing this one a little bit, but it's this midpoint, in fact, hold on. It's this midpoint right here, kind of between the superciliary arches. That's glabella. Okay, move along to the next slide, the parietal bone. Luckily for this one, you just need to know how to identify this. You don't need to know any of the features of the parietal bone. So the parietal bone is this bone right here. So if you're looking from the top down, you'll see there's a left and a right on either side. It's kind of the big bone that makes up either side of like the top of the skull. So parietal, you don't need to know any of the features. You just need to know, like if I had a sticker on this bone and I asked on a worksheet or the exam, identify this bone, then you would know, oh, that's the parietal bone, parietal. The next bone, the occipital bone. Occipital bone is in the back of the head. So here's the skull, right? We're looking in the back of the head. You can see here that suture line is kind of showing where it ends. So it's this bone right here. And it also goes underneath a little bit, like into here, right? So it's the large bone like in the back of your head and kind of underneath. And there are two features that you'll want to know. The first one is this large hole. If you recall from the previous lecture, I talked about the terminology, and foramen is one that you should remember. Whenever there's a hole, it's called foramen something or something foramen, right? So this is called the foramen magnum. In other words, it's a big hole, right? Foramen magnum. It's this large hole right here. So basically, it's the area where the spinal cord can come up and connect into the head to the brain, right? So there's this large hole to accommodate that connection. The other features are right on either side of this, and these are called the occipital condyles. They're right here. Remember, a condyle is usually a raised portion that's kind of round and smooth. You can see and typically it's an area where it's going to connect with another bone. So this area actually connects with the very first vertebrae. So on either side of the foramen magnum are the occipital condyles. On to the next slide. The temporal bone. The temporal bone is on the side of the head. It is the bone right here that is kind of like around your ear, kind of up and around your ear. You have one on the left, you have one on the right. And let's see, I have 3 features here on my PowerPoint, but I think I ended up on the bone list taking one off. I'll just go through these 3. I'm not sure which one. I think I did shorten it on the actual list for you. The first one is the zygomatic arch, which is right here. I have a feeling that was the one I removed off the list. Either way, I'll just explain it really quick. So here we have the temporal bone. This little area right here is called the zygomatic arch. Then we have, if we were to kind of lift this and look under, we've got the mandibular fossa. So that is right here. Basically, when we do have the mandible, like the mandible would be like right here, right? It's gonna come up and attach like kind of up under your ear a little bit. So that area, the fossa, a depression, remember a fossa is a depression. So that is the mandibular fossa. A lot of times the names kind of give you a clue as to like what it's touching, where it's located, what it's doing. Not all of them, but a lot of them do. And then mastoid process. So if we're looking at this individual from the side again, sorry, hold on. These nails, there we go. The side, you can see here hanging down kind of below, this is like your ear hole, right? Right below here is this feature right here. Now in a female, it's only gonna hang down a little bit like this. In a male, it can hang down much, much lower, and it can also be thicker. So this area, you can kind of feel this on yourself, like right behind your ear. You have a lot of muscles from your neck that come up and attach to this. So males who have more of a larger muscle complex and structure in like their head and their neck, obviously the areas of the bone where there's muscles, with the larger muscles attached, that area of bone will also be larger. So we'll come back to this feature when we talk about sex determination, but mastoid process. The next bone, the sphenoid bone. The sphenoid bone. So you can see in the image, this is a bone that's kind of in the middle of your head. Now you can see it if you're looking at the back of the eye orbits. You can see it like back here, but it's really, I should have grabbed another one of the skulls. Actually, hold on. I think this one will open for me. Let's see. Damn it. Give me 1 second. lot longer than I thought. Okay, so here I have another skull where I could take the top of the head off. So now we can see, now I wish it were color coded to make it a little easier, but you can still see this whole inner structure all in here. This is the sphenoid bone. It's kind of a bone that looks kind of like a butterfly, and so some of the features are named. As you can see here, we've got one feature called the greater wing. That's, you know, over here and here. In lab, I can show you a sphenoid just by itself, and that'll make it more clear. I'll have one labeled for you to see. But like you can see in the image on the PowerPoint, you can see this bone like from the side, from behind behind in the eye orbits. If you take the top of the head off, you can see it internally, right? You can look underneath and see part of it. So it's really kind of in the middle of the head. Oh, I'm sorry. And then the other feature that you need to know is called the sella turcica. And my pointer dropped, it's fine. The sella turcica, I'll use my nails, right? The sella turcica is right here. Sella turcica means Turkish saddle. So you can kind of see, if I can rotate this a little bit, you can kind of see how this area kind of looks like a saddle. Let me get that glare off a little. Kind of looks like a saddle a little bit, so that area is called sella turcica. Moving on to the next bone, maxilla, the maxilla bone. So this is the bone that makes up a big portion of the front part of your face. So on either side of the nasal bone, so like right here and right here, you probably have been sick and you're like, oh, I have like pain in like my maxillary sinus. That's your maxilla, one on the left and one on the right. And so it's also this area right here on top of like where your teeth set into what's called the alveolus. That area, this whole area, bottom area, is called the alveolus of the maxilla, and that's one of the features that you need to know. And ooh, I have canine eminence on the PowerPoint. I'm pretty sure I'm not going to have you know that one. I think I removed that on the bone list. I should have gone back and double checked these a little bit. I only removed like 2 things though, so I didn't really think it was a big deal. Either way, whatever's on the list is fine. Okay, and moving on to the next one. Hello. The zygomatic bone. So zygomatic bone is right here. So you might think of like, oh, like my cheekbones, right? So it's this bone right here. It goes partly up into like makes it part of the eye orbit a little bit. On this side, it comes down here. It kind of arches towards the back a little bit. Like you can see this connection between the temporal and the zygomatic, and this area we think of like that's kind of like our high cheekbone. It's back here a little bit. So that's actually 2 bones connecting with each other. So the zygomatic is this area like right on the side, you know, right here on the side of your, I got my glasses on, I'm blocking myself. It's on either side, you know, right here on the eye. Let me see if I can still read without those on. I think it's better, it's too much of a glare on those glasses. The, let's see, the next bone is the lacrimal bone. The lacrimal bone is just this tiny little bone on the inside of the eyeball. Just know the name, the eye orbit. Just know the name of that bone. And then the next one, the nasal bone. You guys are familiar with this one, right? So the nasal bone is right here. You actually have 2, a little one on the left, a little one on the right, but it makes up this area right here. So the nasal bone, pretty easy. No features, so you don't need to know for that one. And then the next one, the mandible. The mandible. Ooh. Oh, good, I have a mandible. I was like, I don't have a mandible out. Here we go. Mandible, I'll bring out this person again. So we've got, let's see, we've got the mandible, right? You guys know, like jaw, the mandible. So let's see, we've got the ascending ramus. The ascending ramus is this part. So this kind of flat part right here on either side of the mandible. And then we have the mental eminence, which is this midpoint in the chin. Now you might be thinking, mental eminence. Mental eminence sounds like it would be a feature on like somewhere on the top of the head, right? When I was taking this class years ago, my instructor said the best way to remember it was mental, like thinking. You do this, like, you're like, I'm thinking. You do this when you're thinking, so mental eminence. And the next one, mandibular condyle, which I think I took off the list, pretty sure, but if not, it's just this feature right here, right? There's a lot of more features I wish I had the time to talk to you about. And I think when we do like sex determination, I'll get into a few more. it's just, even when it's the regular semester, there's just so much information, features that I think are important that I love to point out. But with the shortened time in the summer, it's just, trying to give you some of the basics, right? Like you can imagine a bone like the sphenoid, I've given you 2 things to know, or even on some of the bones, if I give you 1 thing to know, you can imagine there's like 20 to 30, right? So, okay, the next slide. Oh, in my life, I'm always like, that looks like a bone, that looks like a bone. And so here you can see that's funion, mandible. It does look like a mandible though, that's funny. And then next, the cranial sutures. I'm gonna put my glasses back on so I can see. Okay, so the cranial sutures, remember we talked about suture lines. That's the area that indicates a joint, right? 2 bones connecting with each other, that creates that line, like on the skull, and we know that's the joint. Well, these lines are called sutures, and all of the different ones on the skull have different names. So I have a few that I want you to know. Let's see, let me go through these. I already feel like you're probably watching this feeling a little overwhelmed with everything you have to learn. I'll just say, I said this in a previous lecture, but I'll say it again. The way I'm going to test you guys is going to be a lot different than a normal semester, because there's just no human ability to be able to memorize all of this in like a day or a day and a half, right? So don't stress about that part. Dive into this as best you can, and we're going to work in the lab together. But as long as you take good notes, you have the PowerPoint, you're invested in this class, you're going to do fine. Okay. So going back to the sutures, we've got, what am I showing you? Oh, the lambdoid suture is this one here, separating the occipital from the parietal bones. It's this one right here. The squamous suture, sorry, I was thinking the squamous suture, that's the one right here that is separating the temporal bone from the parietal bone. Did I skip a slide? That's weird, I guess not. The lambdoid suture, wait, hold on. Did I say that one already? I'm sorry. Lambdoid suture, squamous, coronal, I'm sorry, I'm like all confused. Coronal is this one right here. So coronal is separating the frontal from either parietal, so the coronal suture. If you go to the next slide, you'll see a couple more. The sagittal suture, so that's right here, right? Yeah, some of these, I only put a few of these on the bone list, but I'll just go through a few of them just so you can kind of know a few. We got the frontonasal. Frontonasal separates like the frontal from the nasal. We've got the zygomaticofrontal. Like I said before, a lot of the names are in like tell you what it's doing and where it is. So we've got like the zygomaticofrontal, so the zygomatic, and then the frontal. There's a little tiny suture right here, right? There's like the zygomaticomaxillary suture. That's right here. So it's separating the maxilla from the zygomatic. Like I could list them all, right? Typically they reference either bone, like that. Sometimes like the sagittal, it's just one you have to remember, right? So there's like names for all of these little tiny ones. I just given you like the bigger ones. That's fine. Okay, moving on to the next slide, human dentition. You guys are probably familiar with some of these terms like incisors, canine, premolars, and molars. So basically what I want you to remember about this is that those are the 4 types, right? And then we have a certain number in our mouth. So if you go on to the next slide, you'll see first off, permanent versus deciduous teeth, or adult teeth versus, baby teeth. So you only have 20 baby teeth, and then when those fall out, you get a full set that's a larger number, 32 permanent adult teeth. Most of us don't have all 32 because a huge portion of us as adults get our wisdom teeth pulled, so we have more like 28, maybe you have fewer than that if you lost a tooth or something like that, But going on to the next slide where it says human dentition 3, you can see that we separate the dentition into quadrants, so like upper left, lower right, lower left, upper right, And for any given quadrant, you're going to have the same number of teeth. And for us, we call this a dental formula. And for humans, our dental formula is 2, 1, 2, 3. 2 incisors, 1 canine, 2 premolars, 3 molars, right? 2, 1, 2, 3. So let's say that was a question on the exam. What is the dental formula for humans? 2, 1, 2, 3 is all you would need to know. And those numbers in that order represent incisor, canine, premolar, and molar. Now for a lot of the other primates, which we'll get into in the third section, they have a similar dental formula to us, some don't, right? So 2, 1, 2, 3. So next, moving into the vertebral column. Let's see, what do I have here? Protects the spinal cord, of course. There are 24 total bones. Let's show you this guy, right? So you can see all of the different vertebrae. This side a little bit. All of the different vertebrae. You have 24, all the way from like the top, like right under your skull, to like your lower back. 24. We also have at the base of the spinal vertebral column is the sacrum, and then the coccyx. Coccyx is your tailbone, the technical term for your tailbone. It's kind of like the worst dry mouth. It's from like talking this whole time. Okay. Next slide, vertebral types. 3 main types: cervical, thoracic, lumbar. Cervical are at the top, thoracic in the middle, lumbar at the bottom. And you can see here on the PowerPoint slide, there are 7 cervical, 12 thoracic, and 5 lumbar. And as you can imagine, they each look quite different from each other. In a general sense, they go from like smaller up here to like larger as you go down. And if you go to the next slide, you'll see kind of that side by side of the cervical, thoracic, and lumbar. So some similarity in that they're, all in the back. So they have kind of a body part and some things sticking out to the sides a little bit. They have some general similarities, but obviously they look very different. It's because they all kind of serve different purposes where they're located. Like as an example, the thoracic, the middle section, all of the ribs attached to those. So they obviously have some different areas where the bone is protruding due to those connections. And I'll show you in class how to differentiate. I'll give you some little tricks that I've learned over the years to help you identify cervical versus like thoracic versus lumbar. Moving on to the next slide, you don't need to know each and every single one of these bones. Like as an example, what I mean by that is when I was taking an advanced osteo course years ago, we had to know the difference between like T1 and T4. You do not need to know that for this class. But there are 2 bones that I'd like you to remember, C1 and C2, only because they look very different from all of the other vertebrae, and they look very different from each other. So the first one is C1, and we call that the atlas. If you forget that part, that's fine. If you just said C1, that's perfectly fine. If you call it the atlas, that's fine as well. So you can see here on the image, the atlas is a vertebrae, but it's lacking kind of this body part, what we call the body of the vertebrae, kind of where they stack on top of each other, this kind of dense part. That bone does not have it. I didn't think to have that one out right now. I'll show you. You're going to see all of this in the lab, whether I show you on the video or not. And this is, so basically it looks like just a big circle. And this is because a feature of the bone right below it, C2, or the axis, has to have room for this. You can see this on the image. This little feature is called the dens. The dens is kind of this protruding part that sticks up from C2. None of the other vertebrae look like this. These are the only 2 that look so weird looking. And it's because they work together. Basically, this protruding feature, the dens on C2, and the fact that C1 has a big open space, it allows you to kind of it allows for this rotation of the head, that there's a little bit more of a swivel with those first 2 vertebrae, that you can do that a little bit more. Moving on to the next slide, once again, I got a sushi C2, right? That to me, that looked like a den sticking out. Okay. Some of the vertebral landmarks that I want you to know, gosh, there really are a lot for the vertebrae. I've given you just a few to know. Spinous process, you know what? I wish I would have gotten one out. That's totally my B. I totally forgot about that. We'll just go through what the images show on the PowerPoint, though. You can see, and if you go through them, you'll see that like if you're using the arrows, like the arrows will pop up and show you, you know, which one's which and where it's pointing to. So basically, remember, whenever you see foramen, that's a hole. So the vertebral foramen, all the vertebrae have a hole in the middle. Vertebral foramen, easy to remember. The vertebral body, like I mentioned, that's typically that large area. It can be, you know, circular or oval shape, but all of the vertebrae have some kind of body except C1, right? And then the spinous process, that's the part from every vertebrae that protrudes out on the back. So this right here, these are all the spinous processes. So when you're feeling like your back, or if you're looking at someone, you could see like the little bumps on their back. What you're seeing is that very specific feature, the spinous process. Let's see. Then the next slide, the sacrum. Oh gosh. You know, I don't even know if I'm going to have you really know too much about the sacrum. Probably just be able to identify it. I think I've got a trait or so on the list. Maybe yes, maybe no. Either way, it doesn't matter. I probably won't ask you too much about that one. Moving on to the next. You're like, thank God, right? One fewer thing. The next thing. Okay, so the thorax. So luckily we've got the guy, right? But I've got a more close-up version of this, right? So let's see, on this slide, we've got the sternum and the ribs. So here we have, you know, here's the sternum. So like right here, your breastbone, right? And remember I mentioned that the sternum connects to the ribs via cartilage. This is all of the cartilage, and the ribs would attach to these, right? This allows for there to be a little movement when you're breathing, that it's not just all bone, right? Getting into the sternum specifically, we have like 3 regions to the sternum. This top region here that kind of looks like a heart, kind of heart-shaped a little bit, that is the manubrium. The middle part here is the sternal body, and this little tiny part here at the bottom that's kind of pointy is called the xiphoid process. Xiphoid process. And also this feature right here, let me see, I'm getting a little glare. See this feature right here, which you can feel and sometimes even see on yourself, like right here. You can feel this little like divot right here, right? That is your jugular notch. Jugular notch, right there. Next, the ribs. Once again, kind of similar to the vertebrae, we have different types of ribs. We have true, false, and floating. Basically, the reason there are differences is just how does it connect? They all connect to the vertebrae, but how do they kind of come around and connect on the front? Either they connect to the sternum via just a little bit of cartilage, like right here, those are the true ribs, or they're a rib that connects via kind of a series of cartilage areas. Those would be like the false ribs. And then you have 2, rib 11 and 12, the last 2 ribs, they don't actually connect to anything in the front. They connect in the back to the vertebrae, but not to the front. So we call those floating ribs. And the next slide you can see, I try to, when I can, throw in some actual images. Usually I use a lot of my own. And you can see here that it's like showing my ribs. You can see like the sternum, the clavicle, scapula, which we haven't gotten into those just yet. But you can see all of the bones on this x-ray. And that wraps that one up. So like I mentioned, if there's any disconnect between what's on the list and what I maybe mentioned an extra landmark or something like that in the video, I would just go off what the bone list is, because by the time I finalize the list after the recordings, the list is really going to be what I want you to know. So I wouldn't stress too much about that. And like I said, if it's one little trait, it's not really going to matter. I'm giving you a list, and I'm going to try to quiz you on every one of those things at some point, but it's not as if you get one little tiny thing wrong, whatever it is, a bone name, a sex determination feature, I would say the general rule right now is don't stress. I'm going to make sure everyone is successful in this class. But okay, see you guys on the next one.